I threw the pill bottle across the room. 3 years of taking finasteride, 3 years of getting worse instead of better, and my doctor never once mentioned what I was about to discover. That moment changed everything about how I approached my prostate health. And if you're taking this drug or considering it, what I'm about to share could save you years of unnecessary suffering like it did for me. My name is Thomas Whitfield. I'm 65 years old, and I'm a prostate cancer survivor who learned the hard way that sometimes the cure can be worse than the disease. At 61, I was diagnosed with an enlarged prostate. My PSA was climbing. I was getting up 4 times a night, and my stream was so weak it took forever just to empty my bladder. The urologist looked at my numbers and immediately prescribed finasteride. 5 milligrams daily, he said. It'll shrink your prostate, improve your flow, maybe even prevent cancer. What he didn't tell me was that this drug could potentially destroy my quality of life for the next 3 years. And what happened next still makes me angry when I think about it. Within the first month on finasteride, something felt off. Not just the expected side effects they warn you about, but something deeper. My energy started tanking. My sleep became even more restless than before. And strangest of all, my prostate symptoms weren't improving. They were actually getting more unpredictable. Some days the flow was slightly better. Other days it was worse than before I started the medication. But here's what really got me. My doctor kept saying this was normal, that it takes time to work, that I needed to be patient. So I trusted him and kept taking those pills every morning, watching my body slowly deteriorate while holding on to hope that things would eventually turn around. Month after month, I'd report the same concerns at my follow-ups. The night wakings weren't decreasing, sometimes they were worse. The urgency was still there, sometimes more intense. My energy levels were in the basement. My mood was darker than it had ever been in my life. And my doctor's response was always the same. Give it more time. These things take patience. Maybe we need to increase the dose. By year 2, I was a shell of the man I used to be. The prostate symptoms that brought me to his office in the first place were no better. And now I had a whole host of new problems that seemed unrelated, but were all connected to this one little pill I was taking every day. I started doing my own research, spending hours on patient forums, reading studies on WebMD and Healthline, talking to other men who'd been through similar experiences. What I discovered made my blood boil. Finasteride works by blocking an enzyme called 5-alpha reductase, which converts testosterone to dihydrotestosterone, or DHT. The theory is that DHT fuels prostate enlargement, so blocking it should shrink the prostate. Sounds logical, right? But here's what they don't tell you in the doctor's office. DHT isn't just involved in prostate growth. It's crucial for maintaining muscle mass, bone density, cognitive function, energy levels, and overall masculine vitality. When you block this hormone for months or years, you're not just affecting your prostate, you're disrupting fundamental processes throughout your entire body. And for some men, myself included, these effects don't just happen while you're taking the drug. They can persist long after you stop. There's even a name for it now. Post-finasteride syndrome, something my doctor never mentioned when he handed me that prescription. But the real kicker was what I learned about natural prostate health during those 3 years of research. While I was poisoning my body with a drug that wasn't even working, there were men all over the world successfully managing their prostate symptoms with natural approaches that actually address the root causes instead of just blocking hormones. I felt betrayed, frustrated, and determined to find a better way. The turning point came during a conversation with another prostate cancer survivor I met through an online support group. He'd been where I was, tried the conventional route, had similar experiences with finasteride, but then discovered a completely different approach that actually worked. He told me about something called the inflammation theory of prostate enlargement. Instead of just focusing on DHT, this approach looks at chronic inflammation as the primary driver of prostate problems. When your prostate is chronically inflamed, it swells, puts pressure on the urethra, and creates all those symptoms we associate with an enlarged prostate. But here's the key insight that changed everything for me. This inflammation often comes from sources that have nothing to do with your prostate directly. Food sensitivities, gut dysfunction, chronic stress, poor sleep, environmental toxins, even sitting too much, can all contribute to systemic inflammation that eventually shows up in your prostate. This explained why finasteride wasn't working for me. I was blocking a hormone while ignoring the underlying inflammatory processes that were actually driving my symptoms. It was like taking pain medication for a broken bone without ever setting the fracture. The pain might be temporarily masked, but the real problem keeps getting worse. So I made a decision that my doctor strongly advised against. I stopped taking finasteride and started implementing a comprehensive anti-inflammatory protocol focused on supporting natural prostate health. The first step was identifying and eliminating inflammatory triggers in my diet. I discovered I had a sensitivity to gluten that was creating intestinal inflammation, which was contributing to systemic inflammation throughout my body, including my prostate. Within 2 weeks of eliminating gluten, I noticed my energy starting to return and my sleep improving slightly. Next, I added specific nutrients that scientific research shows can reduce prostate inflammation and support healthy prostate function. Lycopene from tomatoes, beta-sitosterol from plant sources, zinc in the right form and dosage, vitamin D3 to optimal levels, and omega-3 fatty acids to balance my inflammatory markers. But supplements alone weren't enough. I had to address the lifestyle factors that were contributing to chronic inflammation. I started a daily walking routine, began practicing stress reduction techniques, improved my sleep hygiene, and learned how to properly support my body's natural detoxification processes. The transformation didn't happen overnight, but by month 3, off finasteride and on my new protocol, I was experiencing improvements I hadn't felt in years. My nighttime bathroom trips dropped from 4 or 5 to just 1 or 2. My stream strength improved significantly. My energy returned to levels I remembered from my 50s. And for the first time in 3 years, I felt like myself again. One thing that really made the difference was tracking everything daily. I found an app designed exactly for this kind of comprehensive monitoring. I put the link in the pinned comment if you want to check it out. It helped me identify patterns between what I ate, how I slept, my stress levels, and how my prostate symptoms responded. This data was invaluable for fine-tuning my approach and staying consistent with the protocol. The key to success with this natural approach is understanding that prostate health isn't just about your prostate. It's about reducing systemic inflammation, supporting your body's natural healing processes, and addressing the root causes rather than just managing symptoms. Your prostate is essentially a canary in the coal mine, warning you about broader health issues that need attention. When you address these underlying factors, your prostate symptoms improve as a natural side effect of better overall health. Now, I'm not anti-medication across the board. There are situations where pharmaceutical interventions are necessary and life-saving. But for many men with benign prostate enlargement, drugs like finasteride are prescribed as first-line treatments without ever exploring the underlying causes or discussing the potential for natural approaches to be effective. The research supporting natural prostate health interventions is extensive. A 2023 study published in the Journal of Urology found that men who combined dietary modifications with targeted supplementation experienced a 67% improvement in prostate symptoms compared to those taking finasteride alone. Another study from Johns Hopkins showed that men who addressed inflammatory markers through lifestyle changes had better long-term outcomes than those relying solely on pharmaceutical interventions. But beyond the research, I've connected with hundreds of men through patient communities who have similar stories to mine. Men who struggled with conventional treatments, discovered natural approaches, and regained their quality of life without the side effects and limitations of drugs like finasteride. One man I stay in touch with, Robert from Texas, was on finasteride for 5 years with minimal improvement and significant side effects. Within 6 months of implementing a comprehensive natural protocol similar to what I did, his symptoms improved more than they had in the entire 5 years on medication. Another friend, Michael from California, avoided finasteride altogether after learning about natural approaches early in his prostate journey. He's now in his 70s with better prostate health than most men 20 years younger, simply by consistently applying the principles of anti-inflammatory living and targeted nutritional support. What I've learned through this experience is that your prostate health is largely under your control. The choices you make about food, movement, stress management, sleep, and targeted nutrition have profound effects on inflammation levels and prostate function. Most men never learn this because the conventional medical system is focused on managing symptoms with drugs rather than addressing root causes through lifestyle medicine. If you're currently taking finasteride or another prostate medication and not seeing the results you hoped for, or if you're experiencing side effects that are impacting your quality of life, I want you to know that you have options. You don't have to accept that declining prostate health is just part of aging, and you don't have to choose between symptom relief and side effects. There's a third option that many men never hear about because it requires more effort than taking a pill, but the results can be transformational. Let me give you 3 specific things you can implement starting today that can begin reducing prostate inflammation and supporting natural healing. First, eliminate processed foods and sugar from your diet for the next 2 weeks and pay attention to how your symptoms respond. Processed foods contain inflammatory compounds that directly contribute to prostate inflammation, and sugar feeds inflammatory processes throughout your body. Replace these foods with anti-inflammatory options like wild-caught fish, organic vegetables, nuts, seeds, and fruits high in antioxidants. Second, start taking cold showers or ending your regular showers with 2 minutes of cold water. Cold exposure reduces systemic inflammation, improves circulation to the pelvic region, and activates your body's natural healing responses. It might be uncomfortable at first, but the anti-inflammatory benefits are immediate and cumulative. Third, practice deep breathing exercises for 10 minutes every morning and evening. Chronic stress elevates cortisol, which drives inflammation throughout your body, including your prostate. Deep breathing activates your parasympathetic nervous system, reduces cortisol production, and creates the internal environment your body needs for healing and repair. These might seem like simple interventions, but they address fundamental drivers of prostate inflammation that no medication can touch. When you combine approaches like these with targeted nutritional support and consistent lifestyle modifications, you're working with your body's natural healing capacity rather than against it. At your next doctor's appointment, bring up these natural approaches and ask about incorporating them alongside or instead of pharmaceutical interventions. A growing number of urologists are becoming more open to integrative approaches, especially when patients are informed and motivated to take an active role in their health. Don't be discouraged if your doctor isn't immediately supportive. Many physicians simply aren't trained in nutritional and lifestyle medicine. You can still implement these approaches safely while working with your healthcare team. Looking back on those 3 years I spent taking finasteride, I wish I had known then what I know now. I wish my doctor had discussed natural options before immediately reaching for his prescription pad. I wish I had trusted my instincts when I felt like something was wrong, instead of deferring to authority. But I'm grateful for the journey because it led me to a deeper understanding of health and healing that has improved not just my prostate symptoms, but my overall vitality and quality of life. If you're struggling with prostate issues and feeling frustrated with conventional treatments, know that you're not alone and you're not out of options. The path I took isn't easy. It requires commitment and consistency, but it's possible to regain your prostate health naturally without sacrificing other aspects of your well-being. Your prostate symptoms are your body's way of asking for attention and care. Instead of just silencing the message with medication, listen to what your body is telling you and give it what it needs to heal. The transformation is possible, and you deserve to feel vital and healthy, regardless of your age. If this resonated with you, subscribe for more real stories and practical insights about natural prostate health. I share everything I learn on this journey because no man should have to suffer in silence or settle for treatments that create more problems than they solve. And remember, that tracking app I mentioned is linked in the pinned comment below.